Okay, will you show us an example? Will you
Sure.
show me?
Yeah.
Okay, guys, this is the last question. We're gonna get this one going. So I'm gonna pull this computer back. I'm gonna try to go kind of slow here. I know we don't have a ton of time left, but I'm gonna hop on the table. Does that look good, Megan?
Yeah.
Go that way, maybe a little bit. Okay.
Okay, so the biggest thing when people come in is that CAM exam that we talked about. The body's going to lead us exactly where we need to be. So there's a lot of different things that we can do for just the camera angle and everything. We'll do a little bit in her lower body and see if we can't come up with anything that's happening. Go ahead and rotate your foot in for me and relax. Rotate this foot in. Relax. A little bit harder on that side.
Yeah.
I don't know if you can see in the camera, but her leg is like shaking trying to make that happen. Go ahead and rotate out for me and relax. Rotate this side out and relax. Okay. And I want you to go ahead and lift this leg up for me as high as you can and relax. Move back down a little bit. Try and keep this hip down on the table and lift your leg up for me. Okay, and relax.
It's definitely harder keeping the hip down.
Yeah, that's the thing is people like to cheat and compensate to try and make things happen. So you definitely have to keep an eye on them and make sure that they don't get to do that. Go ahead and bring this leg up for me. Oh, okay, relax. Again, she is shaking pretty bad. And I don't know if you guys can tell the difference between this side to side. Go ahead and lift this side up again for me. And relax. And then lift this side up. She's working hard and it just doesn't want to go.
Oh, my back too, like my lower back is coming off the table.
Yeah, because you're still trying to make that motion happen, but your muscles are saying we can't do this.
Yeah.
And so everything else is trying to cheat and compensate to give you more motion.
Right, okay.
So this is where I would be starting. I mean, this is a pretty big, like I said, an elephant. This is a pretty big discrepancy that we have side to side. So I would start working and testing everything that moves her into hip flexion. Mm-hmm. And then ideally at the end, we would check this again and this leg would be able to move a lot better.
Yeah.
And then you shouldn't feel the back working and everything trying to make that motion happen.
Okay. So, I sit at my desk all day.
Yeah.
So, like, could that be part of the reason why I'm experiencing some lower back pain is because my hip flexors aren't.
Absolutely.
Like what you were saying before.
Exactly. That's a perfect example of that.
Yeah.
Because your body still needs to sit in your chair.
Yeah.
But your hip flexors are saying, I mean, ideally your hip's getting to 90 degrees to sit in a chair.
Right.
You were getting 30
Right.
on that side, maybe
Right.
40
Right.
if we're generous.
Right.
Which
okay.
means those back muscles, especially on that right side, may be saying,
Yeah.
you need to get out of that position. So if you've been sitting for too long, you may feel some tightness, just your body trying to get you up and moving and saying, there's an issue here. There's a reason why you can't be doing this.
Okay. Yeah, that makes sense.
Mm-hmm.
Okay, cool. Thank you.
Yeah.
Okay. Okay, you guys, so we're going to conclude this webinar, and we're hoping that you really enjoyed it. We know it was a little bit more informal from the last one, but if you guys, have more questions, feel free to email us. I'm not sure if Megan said, but on the education side, if you're just curious, you want to know more about our education programs, you can email info@muscleactivation.com. You can also email support at muscleactivation.com, and you can learn about our programs there. You can also learn about practitioners in your area if you're interested in getting worked on. And honestly, just in general, if you have questions for us, please, we'd love to hear from you. If you have ideas for this next webinar and you want to hear on a specific topic, we'd love to get it out there. We just want to, get people excited and, kind of bring more people into our community because we love MET so much. And so we just want everyone to know about it. And then lastly, on the Broadview side, I'm not sure if you heard me mention at the beginning, but we do have an online education program that we didn't really speak to. And that program is offered through Broadview University. We did a collaboration with them. And if you want to learn more about our online programs, that you can find on Broadview, but you can also find it on muscleactivation.com as well. So any and all questions, just shoot them our way and we'll get them answered for you. And then obviously, thank you, Megan.
Thanks for having me.
You're awesome. So, okay, guys, we'll talk soon.